reading a paper from start to finish. So now that you have seen the bigger picture about biostatistics and the support of public health research, you'll end up reading a lot of papers as you move forward in a research-related career. And whether that is patient-facing, so if you're a physician or a nurse or a dentist, or if it's in a laboratory, or if you're working in clinical trials, or if you become a researcher in your own topic areas, you'll read a lot of papers, and it can be really daunting to just try to sit down and read a paper from start to finish. And in fact, that's not a good use of your time, because a lot of the papers that you look at when you first start doing this, or when you first start researching any topic, actually may not be relevant to what you're doing. So let's take a look at the best way to approach reading a research paper. So we'll look at the layout, and then we'll look at the 3-pass method, and really some questions to ask yourself when you're reading papers. So let's think about the layout. In general, most research papers will obviously have a title, an abstract associated with them, which is a basic summary, an introduction or background of the topic, methods, results, and a discussion. The abstract, methods, and results will often have multiple subsections, and these can be determined by the field you're in, or even specifically by the journal that you're submitting to if you are the author. And so they'll vary from paper to paper, but generally in the abstract, you'll have 4 sections. And the abstract, again, is a short summary of research, published or unpublished. So it may be in submission to a meeting, or you may be reading the abstract at the start of a paper. And it generally has objectives, methods, results, and conclusions. Abstracts are usually restricted to 250 to 300 words, and there will be generally no figures or tables used in an abstract. The objectives, you list your main goal, and it's 1 to 2 sentences long. It should give the reader an overall impression of what the point of the full paper would be. The methods section will talk about the study type and population, and it will cover the main statistical approach for the primary hypothesis and maybe one additional hypothesis. The results will contain a cohort description, so your sample description, and the results for the main hypothesis, and maybe again another secondary hypothesis. And then the conclusion will have the overall interpretation and is again only 1 to 2 sentences. Writing an abstract is an art. You get better at it the more that you do it. Generally you'll start with about 600 words and then whittle it down to the necessary information. But reading an abstract, you should have a pretty good idea of what the purpose of the study was, who was in the study, what was the main question being asked, and then what were the results. If you go from there to the methods section in a paper, this is where you get to the sort of 5 W's, the who, what, when, where, why, and how. Well, the why will be covered in the introduction of the paper. The methods section of every paper will look at the who, so what is your sample, how did you get it, where did it come from? The what are the outcomes and variables being collected? The when, what is the timing and duration? The where, what are the study locations? The how, the statistical details. And then also the results section often will have multiple sections. So you'll have the cohort results, so describing the sample, which has your N recruited, the completed, age, race, ethnicity, gender, and then disease characteristics or population characteristics. The outcomes results, and there generally is a subsection for each type of outcome. So it can be divided up by hypothesis. So if you have a primary hypothesis or secondary or tertiary, or you can divide it up by outcome types. So clinical outcomes, so blood pressure, patient-reported outcomes, how do they feel? Image outcomes, so MRI or X-ray, and then labs, etc. And the results will also include tables and figures as needed. So once you sort of know the layout of a paper, you know how to approach reading a paper. And this 3-paths method you will refine over the course of your research-related career according to what is most comfortable for you. In the first pass, title, abstract, tables and figures, and conclusions. So read the title of the paper, read the abstract of the paper, go through the tables and figures, and then read the conclusions section. Some people feel more comfortable doing title, abstract, results, and conclusions, but until you're really familiar with the variables and the questions, reading the results can be a little bit trickier. You'll get better at that as you become more familiar with the field. So what should you know at the end of the first pass of a paper? You should be able to understand the disease area, the main question, who was in the study, that table 1 that we've talked about, and the main outcome variable and result. And this can come from tables and figures, or it can come from the results section. So this is what you should know after the first pass. Based on this, you should be able to determine if this paper is relevant to what you need to learn. And if it's not, then you don't need to move forward. Once you've looked at the first pass, you'd want to go then to a second, more in-depth pass at the paper. That's where you'll fully examine tables and figures. Look at the units, look at the axes, look at what the results are in the tables and figures. Can you determine where their differences are? Can you determine what is related, which variables are related? Then you need to read the methods section. What are the statistical tests that were used? And what are the assumptions that the authors made about their data or about the statistical tests or about their population? And then you need to really dig into the results and make sure to determine whether or not they actually answered the questions they set out to answer. An example where this doesn't happen would be a study that wanted to know if chest compressions plus breathing in CPR was superior to chest compressions alone. And then they run a study and all they talk about is what happened with chest compressions alone, and they never actually address the comparison of the two methods. And then in the results part are the results that they publish from the methods they said they were going to use. So if in the methods section they say that they're going to compare the mean between two groups, but in the results, they're talking about the proportion with, say, high blood pressure instead of the mean high blood pressure, then there's a disconnect there. So they have switched methods in the middle of the paper, and that's not okay. That's a major criticism if they don't address why they did that. So make sure that what they say they're going to do is actually what they do, and that when they answer the question, it matches the question they proposed at the beginning of the paper. And once you've done that, you can really sit on a third pass and play a detective. Again, do the conclusions match the results? So you've already read the conclusions, and then you went back and read the results. And are they saying what they found? So if they didn't find a statistically significant difference in the results, but in the conclusions, they talk about things being different, that's a problem. What assumptions did they make? What limitations do they list? What limitations do you find? Is there anything wrong or missing? So if they laid out a bunch of questions in the introduction but didn't answer them, why do you think that is? Or is there just something incongruent in the paper that they lay out a great scientific rationale for their study, but then they study something totally different? So a good example would be to talk about how walking speeds are improved with muscle strengthening. But then what they actually do is simply use electronic pulses to measure times of muscles firing. They don't actually measure walking speeds. So they've sort of missed that link that connects the speed in which electronic pulses are detected in muscles and linking that to walking speed. So is there something missing in the paper? And then what would you do? If you were going to design this paper, what would you do? And what other questions would you ask? So that would give you, those 3 passes combined, will give you a really good, thorough understanding of the problem, the research that they conducted, and the conclusions that they drew. And at the end of it, you should be able to ask or answer these questions. Where was the research done? What types of centers, what countries is this research going to be applicable to my research? Also look to make sure if they have a named statistician. They should. So you can look at the author information and see if there's somebody with a statistical training. Are there other people or other statisticians that are named in the process? Is this relevant to your own research? Could you replicate this from the information provided? And then are the references that they give up to date? And you can also track those down too to find out more information about the field. And that's really how to read a paper from start to finish. Start with glossing it over, digesting the questions, learning about the disease area, look at those figures and tables, and find their conclusions. And then go back and really dig in to get a deeper look. And over time, you'll become much more proficient at reading research. In fact, it will take you an hour or more to read papers when you begin. And within a few short years, you'll be reading papers within 10 to 15 minutes and determining whether or not they are useful to you.